Hello, this is Dr. Claudine Roura, the Fat Sucker, and welcome to my channel. Today, we are going to be talking about subcutaneous fat versus visceral fat. What is the difference between these two kinds of fat? Now, first of all, subcutaneous fat. Sub means underneath the skin. So that's why it is called subcutaneous fat. Okay? It is the kind of fat that you can actually pinch. So whatever you pinch basically is more of subcutaneous fat. So that is on top, very superficial, just underneath the skin. This is the kind of fat that is subject to liposuction. So when it is subcutaneous fat, we can do liposuction for that. Visceral fat. Now this is the kind of fat that is actually inside our internal organs. Okay, so when you actually see a globular abdomen na medyo malaki, medyo matigas, okay, this is more of a visceral fat. So I'll show you some samples. Ganitong klaseng tummies. Okay, so you would tell me like, oh, this is a good subject for liposuction. But unfortunately, no. Even if you have a big belly, if it's in the upper parts like this, and when you touch it, you know, it's hard, matigas. Halos wala akong makuhang skin. This is mostly visceral fat. Okay, so this is not a subject for liposuction. So this one, no lipo, diet, exercise. Now this patient here, we already did a tummy tuck for her. Okay, so tummy tuck. Pero if you're gonna take a look, see, tummy tuck na siya. Bakit, bakit malaki pa rin, okay? So this one is actually, she had a very, very long abdominal apron. Sobrang daming skin. 8 months post-op, right? So, already, she has a very tight tummy. However, this part here is, matigas na. Wala nang makurot. So, there's no more subcutaneous fat here. Basically, this is more of visceral fat. This is taken care of by, again, extreme diet and exercise. We have here our patient. She is actually on the obese side. Obese patients have a combination of, okay, subcutaneous fat, a lot of subcutaneous fat. But at the same time, they have a lot of visceral fat, which is usually on inside the abdomen. Tinatawag nila the fat in the gut. Marami dyan sa loob na yan. So when they lose weight, the subcutaneous fat is can be taken care of by liposuction. However, the visceral fats, hindi talaga. Okay? You really need a very good diet and exercise program to remove this one. Okay? So, this one talaga, kailangan niya talaga ng diet and exercise because I have a lot of patients who are actually on this category who wants liposuction. So, if they're really overweight, medyo on the obese side na talaga, I ask them to lose it first, either go bariatric, go on a keto diet, a very strict diet and exercise program. When you come into a plateau, pag ayaw na talaga mag-move, that is the time we do this body sculpting. So, this one, subcutaneous fat, and visceral fat. Now, this is a model, okay, of the cross-section of the body. Come on, I'll show you how it is, okay. So, this is a slimmer person. This is a heavier person. Now, cross-section. This is our subcutaneous fat. These are our muscles. That is the pelvic bone. And this is our internal organs. Okay, so these are both. This is slimmer. This is a little bit on the chubbier side. Now, if you see the subcutaneous fat, this one, this is the only one that we can do lipo for. This is your visceral fat, okay? These are the fat inside the intestines, internal organs. This cannot be taken care of by liposuction. This is extreme diet and exercise. See? So, if you see here, it is going to be the bone, the pelvis. If you put them together, there you go. Slimmer person, heavier person. Okay? So, when you gain weight, you increase the subcutaneous fat as well as you also increase the visceral fat. Subcutaneous, pwede lipo. Visceral, cannot be lipo. It has to be behavioral modification, lifestyle change. Okay? So, that's it. Subcutaneous and visceral fat, ano pwedeng gawin dito? Okay, again, subcutaneous, pwedeng i-lipo. Visceral, hindi pwede i-lipo. This is internal organs. Okay? So basically, as I said, this one, diet, exercise, lifestyle modification, behavioral modification, lifestyle change. There is no magic pill. There is no instant slim. If you actually gained all that fat over several years, you also have to lose it over a certain period of time. Talagang struggle. Because kapag lifestyle modification ang gagawin natin, that is where you will have long-term results. So again, lifestyle modification, behavioral modification, lifestyle changes, diet and exercise. Long-term results. Okay, so after you do your diet, exercise, where does the liposuction come in? Okay. So, when you hit a plateau, ayaw na niya, no? At the same time, kunyari payat ka na, but you still have a lot of this unwanted fat. No? Maluwag pa rin, you have a lot of stretch marks, a lot of sagging. That is actually the time that the body sculpting comes in. Again, when you are already in the plateau stage, okay, this is the time that we come in and actually push you further to achieve the actual body that you want. Okay, with the liposculpture, whatever tummy tuck, whatever body sculpting that you need. Okay, there you have it. Okay, the difference between subcutaneous fat and your visceral fat. And remember, for liposuction, we can only remove your subcutaneous fat. Visceral part is your job. Because again, we only do until below, under the skin, on top of the muscle. That's only the area that liposuction can reach. Of course, the visceral part is actually in between your intestines, in between the stomach, okay? So, in between your internal organs. Again, liposuction, subcutaneous fat, visceral part, visceral fat is your job. Okay? So, I hope that clears it. And again, obese or overweight individuals, yes, the lipo can actually help jumpstart the weight loss process. Okay? When you do the lipo, when you remove all of the fat, okay, that is actually already a jump start for you to help you lose weight further. And then the diet and the exercise will actually augment the results of your liposuction. And again, if they are too much overweight or too obese, we'll actually recommend first to really lose it. Lose as much as you can, either through your own diet or exercise program. And then when you come to a plateau, when it doesn't want to budge anymore, and that is actually the time that we actually do the lipo and the body sculpting. And mostly for these overweight and obese patients, they have a lot of skin, you know? Sobra-sobra yan ng skin. When you remove the fat, they deflate, then you have a lot of skin. That's the next problem. So this is the part that you do your tucks. Your tummy tuck, your arm tuck, your thigh lift, okay? All the tucks and the lift comes after to remove excess skin. There you have it. So I hope I explained it further or clearer to the viewers out there. This is the Fat Sucker, Dr. Claudine Roura, saying, see you in our next episode. Bye-bye. To watch more videos, please click that button down there and don't forget to like, comment, and subscribe to the Fat Sucker channel. And again, this is the Fat Sucker, Dr. Claudine Roura, saying, see you in our next episode. Bye-bye.